Depression happens to all kinds of people. Famous and successful people like Angelina Jolie, Katy Perry, Ellen DeGeneres, and Lady Gaga have been depressed at some point. Depression is common throughout the world. Healthcare providers estimate that almost 7% of American adults experience depression annually. Also, above 16% of U.S. adults, 1 out of 6 adults, will go through depression in their lifetime. The beast called depression can be defeated when you can identify its signs and treat it accordingly. Understanding depression and its warning signs can help you a lot in your personal development. You need to know that depression can ruin your present and future just because you live in the past willingly or unwillingly. Before moving on, how about we discuss the concept of depression? What is depression? Depression is a critical issue and a form of mental illness that is controllable. It is a series of mood swings or disorders where you feel sad and lack the enthusiasm to carry on with productive activities. Some refer to it as a depressive disorder. Depression affects how you think, behave, relate, and feel, which results in physical, psychological, and emotional crises. This condition could make you feel down and less of yourself. It can penetrate you so deeply that you find it hard to concentrate on your daily routine. Depression can make you see no reason for your existence. Just like other abnormalities, depression is also a beast and silent killer. Depression is not a weakness, and it is not easy to come by. It is a challenging situation that requires a strict approach. You do not have to fret. People recover from depression through psychotherapy or medication. Some do the two to feel better. Now that you know what depression feels and sounds like, let's talk about the types of depression before discussing its warning signs. Types of depression. Remember, depression is a medical condition, and its types vary from one person to another. Major Depressive Disorder, MDD. Major depression is also known as clinical depression. MDD has severe symptoms that can last for several weeks. These symptoms have a great chance of messing up your daily activities. In 2008, World Health Organization, WHO, ranked major depressive disorder as the third cause of burden of disease worldwide. WHO projects that by 2030, the condition will rise to the first position. Bipolar disorder. Bipolar disorder is quite common, and you must have heard about it a lot. A controversial celebrity, Kanye West, struggles with this disorder. People with bipolar disorder often switch between low mood and highly energetic periods, also known as manic periods. In their quiet period, they might show depression symptoms such as sadness, hopelessness, and a lack of energy or enthusiasm. If you suffer from depression or know people with it, you will agree that they have a somewhat confusing character. They might be doing perfectly right now. The next minute, you don't know what has gone wrong with them. Persistent Depressive Disorder, PDD. PDD is also called dysthymia. Its symptoms are not as severe as major depressive disorder, but people might experience its symptoms for years. Persistent depression could be chronic because it tends to interfere with your day-to-day activities. You will also be unhappy and find it challenging to be productive. It also affects your personality because people might perceive you to be toxic. Psychotic depression. People who suffer from psychotic depression might be experiencing severe depressive symptoms and delusions or hallucinations. 1 in 4 people is admitted to the hospital due to this type of depression. People living with psychotic depression are prone to lose touch with reality. They become delusional, consistently pessimistic, and feel they have done something wrong even though they did nothing. They think, hear, and see negative things about themselves, while there is nothing of such in reality. Seasonal affective disorder, SAD. This sounds weird, but it is a thing. Seasonal depression or seasonal affective disorder always starts in late fall and early winter and goes away during the spring and summer. This type of depression begins and ends at the same time as the season. Premenstrual dysphoric disorder, PMDD. This type of depression is unique to women. It could affect them for days or weeks before their menstrual period. It affects about 10% of women who menstruate. PMDD is a chronic premenstrual disorder, PMS, that leads to anxiety, depression, and suicidal thoughts. Women with PMDD experience bloating, headaches, and breast tenderness a few days before their menstrual period begins. Perinatal and postpartum depression. Childbirth is way more complicated than what is portrayed in movies. It is an excruciating process where women undergo hormonal, psychological, physical, mental, and emotional changes resulting from pregnancy. Many changes take place in the mother's body and interpersonal life. After childbirth, a mother can experience emotions ranging from genuine happiness to sadness and tearfulness. These feelings of sadness and tearfulness are baby blues and might reduce during the first 2 weeks after child delivery. Perinatal and postpartum depression is another female-related kind of depression. Perinatal means around birth. It could be either during or after pregnancy. Some refer to this type as postpartum depression. Perinatal depression might occur during a pregnancy and up to 1 year after giving birth to a baby. The symptoms could be chronic or mild, and they are more than the baby blues, which lead to little sadness, worry, or stress. Research shows that 1 out of 7 women develops postpartum depression. Having talked about types of depression, how about we talk about the general symptoms of depression? Many people use the words symptoms and signs interchangeably, but they do not mean the same thing medically. First, signs and symptoms are abnormalities that can help determine a potential medical condition. A symptom could be subjective, meaning it is known to the patient alone. On the other hand, signs are objective evidence of an illness that others can observe or notice. It could be people around you or a doctor. To clarify, when you suffer a cold, which comes with headaches, pains, and a runny nose, nobody knows you have headaches and pains until you tell them. Those are symptoms. However, anyone who observes you closely will see you blowing your nose from time to time. That is a sign of cold because they can keep that easily. Symptoms of depression. If you live with someone with depression, you can observe some signs they haven't already noticed. Compared to other medical illnesses, symptoms and signs of the different kinds of depression could be very similar. Here are 8 warning signs of depression. With these signs, you can easily spot and ascertain that someone suffers from depression. Unexplainable pains. Depression affects a person's mental health. It also harms a person's physical wellness. Common warning signs of depression include the physical symptoms of unexplained aches and pains. A study on symptoms of depression revealed that 69% of people who consult their doctors on depression grounds complain about some unexplained pain, headaches, backaches, and bloating. Failing concentration. Everyone experiences brain fog and forgetfulness once in a while. For depressed people, it becomes an everyday thing. They lose concentration too quickly. The lack of focus becomes so frequent that people with depression find it difficult to perform their daily duties at home and the workplace. They stand the chance of making several mistakes, which makes decision-making a nightmare. Much or less sleep. Having less or too much sleep is a warning sign of depression. It is noteworthy that sleeping disorders are not necessarily the cause of depression, but a lack of sleep could bring about mood swings. If you have seen the Spanish TV series Money Heist, you will notice that things begin to fall apart when the bank robbers didn't sleep for 3 days. A drastic change in appetite. Depression can make people switch what and how they eat. For some people, depression makes them eat more, while for other people, depression leads to a decrease in their appetites. However, a drastic change in appetite is a symptom that can negatively affect a person's physical wellness. People losing weight due to depression is not healthy in any way. Also, people who eat more due to depression will possibly gain weight in the process too. Moodiness and irritability. Irritability and moodiness are clear signs of depression. To validate that someone is suffering from depression, you can easily tell when they get moody and small things irritate them. They are likely to get agitated about minor issues. These 2 traits can make people with depression accommodate harmful feelings like suicidal thoughts, thoughts of self-harm or harming others. When you observe that someone has some of these thoughts, ensure they are not left in isolation and get them medical help from a professional as soon as possible. Alcohol or drug use. According to reports from the Anxiety and Depression Association of America, ADAA, 1 out of 5 people with anxiety or a mood disorder such as depression also have an alcohol or substance abuse disorder in the United States. Regular abuse of alcohol or drugs could be a sign of depression. Depressed people might likely use and misuse alcohol or drugs to cope with the negative feelings attached to their condition, emotions like sadness, loneliness, or hopelessness. Negative self-talk. Negative self-talk is a damaging and self-critical conversation. You might hear depressed people talk bad about themselves with no hope that things can get better. People with depression always speak negatively about themselves, resulting in harmful, critical thoughts towards themselves. This would have detrimental effects on their wellness and general cognitive function. Loss of interest in sex. Having a low sex drive is a pointer to severe depression. What you used to find pleasure in will suddenly become dull due to depression. Study shows that more severe depression was associated with more severe sexual dysfunction. This dysfunction was trouble with sexual function, desire, and satisfaction. What is the conclusion? Being depressed is more than being unhappy. Depression is an aftermath of an incident that could be personal. Its warning signs are always visible or observable by the people around them. The essence of knowing the warning signs of depression is to be able to help people with depression accordingly. If you have anyone around you with these symptoms, promptly get them help.